fatigue, or gas? What will today's symptom be? My loopy life with lupus. Hey guys, so I just wanted to kind of do a little lupus update. I went to the lupus clinic yesterday morning, and I am so frustrated. I originally, in 2010, I originally saw this rheumatologist who was amazing. She was the one who diagnosed me as having lupus, and I loved her. She was an amazing rheumatologist. And then I guess it was about a year or two into my diagnosis that she moved. And she moved out of the city. It was too far for me to go to her new office to see her. So she referred me to a different rheumatologist in the same hospital. And I saw her for a while, but I was not happy with that new rheumatologist because I just felt like she wasn't really listening to my needs. She was trying to take me off of a lot of different medications that I felt were helping me at the time. And I couldn't understand her reasoning for wanting to get me off of some of these and stuff. And it just seemed like when I was telling her my issues, she was kind of just not really listening to them. So it was Alex's coworker who has a daughter with lupus and said, your wife should look into going to the lupus clinic. That's where my daughter goes, and they're excellent there. And, they specialize in lupus, obviously. And so I was kind of on the fence about whether to do it. And then we went to the lupus annual general meeting. And so we went to the lupus annual general meeting, and a few doctors from the lupus clinic were speaking there. And the things that they were saying really impressed me. They were talking about how they know that they can't always rely solely on blood work because it doesn't always show up in blood work and stuff like that. And I felt like they seemed to really know their stuff. So, while we were there, I was talking to various lupus patients. Some of them were attending the clinic and said that it was great. I talked to a couple of people that said that they chose not to go there because they heard that you see a fellow doctor before you see the main doctor, and sometimes it's a different fellow doctor each time, and they didn't really like that idea. So I kind of weighed everything out, and I decided to get my family doctor to refer me to the lupus clinic. And at first, I was still seeing the rheumatologist at the hospital, and then I was seeing the lupus clinic. And so it was alternating. So I'd see the lupus clinic, and then 3 months later, I'd see my rheumatologist at the hospital, and then 3 months later, I'd see the lupus clinic. And so I kind of went back and forth for a little while, and then I realized that I preferred the lupus clinic to the rheumatologist I was seeing at the hospital because they really seemed to listen to me. And so I dropped my rheumatologist at the hospital. And I think also what really was the deciding factor was that summer. This was 2 summers ago. It was right after my mom and I got back from the Down East Doll show that I came down with pericarditis, which is inflammation of the lining of the heart. And I went to the hospital that my rheumatologist works out of. Because I figured it's best for me to go to that hospital because my doctor's there and they have all my records there and everything. And I went there, and I was there overnight, and I went home the next day. But while I was in there, Because I think I went home like in the afternoon. So the morning that I was there, they actually contacted my rheumatologist, who was like in the same hospital that I was in, and she did not come to see me at all. And so for me, that was, I think, where I decided to drop her and go with the lupus clinic, because I was like, you know, she can't even take a couple of minutes to come down and see me and discuss like what's going on, because obviously it was a lupus related thing. So I left her, and I've been with the lupus clinic ever since. But lately I've been getting frustrated with the lupus clinic in that ever since I've been going to them, they're questioning the lupus diagnosis. They're saying that I have a lot of features of lupus, but not enough to diagnose. And I'm saying no, because I've looked up the criteria for lupus. There's a list of 11 things, and it says if you have had or currently have 4 or more of the criteria, then they can diagnose lupus. And I have had more than 4 of the things on the list. And so I can't understand why they're still teetering on whether it's lupus or not, especially when they are a lupus clinic that specializes in lupus. I also don't like the fact that I see a fellow doctor first. Now, there was a point where I had the same fellow doctor for like over a year, and she was phenomenal, and I loved her, and I was doing great with that. But she went on mat leave, and ever since then, I've seen maybe like the same fellow like 2 or 3 times in a row, and then I go and there's a new fellow. And I don't like that, because then I feel like I'm starting all over again, because I have to review everything with them. They don't know me. They haven't been following me. I mean, yes, after they examine me and go over everything, they then go and talk to the main doctor, who then comes back in with them. And that's pretty much been the same doctor that I see every time, Dr. Urowitz. But a couple of times he's been away and I've seen a different doctor, but it's not a huge deal. She's really good as well. So basically what happened yesterday is there was a new fellow, and I first off had a really hard time understanding him because he had a very thick accent. Second of all, I really felt that he wasn't listening to me. Now, I told him my joints have been great, which they have, thank God. I told him like the only issue I'm having is my breathing and my jaw, which the jaw, I'm still on the wait list for that. And hopefully whatever procedure I have will fix it. The breathing, I told him I'm not seeing my respirologist until August, and I'll get a breathing test at that time. I asked him about the possibility that methotrexate is causing the breathing issues. He said no, because he said if it was the methotrexate, it would not be happening now, because I've been on the medication for over a year. He said it wouldn't happen at this point. It would have happened a lot sooner. And also it would be so severe that I would be in the ER. I wouldn't have been able to take the public transit to my appointment. So he's like, I really don't believe that it would be the methotrexate. So he said, I just have to wait to see my respirologist and see what the respirologist said. In the meantime, they were planning to try and bring down my prednisone more, because they want to get me off of it, and I want off of it. The last time I saw them, they wanted to go down, but then they decided not to because of the jaw issues, and they wanted to find out what was going on with that first. This time, now that with the breathing issues, they said they want to wait until I see the respirologist to see what we're dealing with, because they don't want it to be like, if it's inflammation causing my breathing problems, they don't want to reduce the steroid, and all of a sudden, like, I get worse with my breathing. So they are leaving me at 5 milligrams of prednisone a day until we find out more from my respirologist. So basically, he did a really quick exam on me, and basically, again, he told me how they're still not sure about the lupus diagnosis. And this time I questioned it, and I said to him, look, I was diagnosed by this other rheumatologist. She told me I had lupus. Now you're saying you're not sure that I do. Can you please explain to me why? And he said, well, he goes, you have like features of lupus, but not enough that we can make a solid diagnosis. And I said, okay, but I've had this, like, you know, I'm telling him everything. And he's like, yeah. And then I said, well, look like, I also have pictures here from different things that I've gone through over the years. And I started to show him like pictures of the hives that I experienced in 2002 and everything. And I'm like, you know, no one could explain what was causing these. I saw an allergist. Allergies were ruled out. Like, I've had all these different rashes over the years, and I've had all these other weird symptoms. I've had pericarditis. I had kidney issues. I had, you know, I'm naming all these things off. And he literally cut me off. He wasn't even really looking at my pictures. And he's like, I know, but he's like, it's not enough to diagnose. And I'm like, what the heck are you talking about? So he's like, I'm going to go and, you know, discuss things with the doctor and come back. And so my regular doctor was away again. So it was this other doctor that I had seen the last time. And she was nice. I was somewhat impressed with her because she brought up the same thing the last time with the other fellow that I saw, saying, well, why is it, like, why are you so hesitant to say it's lupus? Like, why are we so hesitant? Because again, this time she pointed out even more things. Like she said, for one thing, the bowel issues that I had a few years ago, like it was diagnosed as colitis, but it was like autoimmune colitis. She was saying to him, she's like, did that GI doctor like give like an actual, like, did they say it's like Crohn's disease, or did they say it was like this or this? And he's like, well, no, they just said it was like an irritable bowel type thing and whatever. And she's like, okay, well, see, she's like, something like that, because it wasn't diagnosed as a specific disease, it was just like an autoimmune issue. She's like, that can happen in lupus. And then she said, you know, the pericarditis. And then she said, like, have we done x-rays of all of the joints? And he's like, yes. And she goes, now, did the x-rays show any like erosion or damage of the joints? And he said, no. And she goes, again, that could point towards lupus, because she says with lupus, you get like arthritis pain, but it's not the type of arthritis that causes damage to the joints. Like, it's not like a rheumatoid arthritis where like you're going to get like erosion in the joints. So she says, again, that's another thing that can be pointing to lupus. And then she said, now the kidney issue that I had at the time that the other rheumatologist diagnosed me was a very minor kidney issue. She asked if they had done a biopsy at that time of my kidney, and, you know, no, they didn't. She said, well, that is the problem, because she says, we don't know what was causing the kidney issues. If they had done a biopsy and it had come back saying there's lupus in there, that would have been a big, like, help. But because they didn't do a biopsy, they're kind of like up in the air as to what that was. But I'm thinking, like, look it, like, you're saying the bowel issues basically point to lupus. The arthritis, I've had all these weird rashes that no one can pinpoint to anything in particular. The breathing issues, the pericarditis, that's already 5 right there. That's already 5. And then the kidney issues, even though they said that they can't pinpoint it to that, you know, kidney issues is on the list of criteria. That would be 6 things right there. So I can't understand why they are having such an issue with this. She said again, I have a lot of features of lupus, but not enough to diagnose. And I just don't understand that. And they're saying my blood work is all fine now. It's all normal. Like, I don't even know if I'm getting a positive ANA anymore, because I know that I was at one point. But I know that that can come and go. And that's what they talked about in the annual general meeting, was that it can come and go, and that they know that they can't rely solely on blood work. So I don't understand why. I just don't understand why they're so hesitant. And then she says to me, she goes, well, you know, for you, having a label for it doesn't really matter, because right now your symptoms are pretty well controlled with the medication we have you on, and it's working, and that's what matters. But she said, for us as doctors, we do like to try our best to get a label for something so that we know what we're dealing with. But she's like, so that's why we're watching you and monitoring you. And, you know, that way we can hopefully make up our mind. And I'm thinking, well, like, how long is it going to take for you to make up your mind? Because I've been going there for a few years now. And in my opinion, I have more than 4 of the criteria for lupus, whether I have it now or I have had it in the past. So I don't understand what the issue is. And in my opinion, it does matter to me, because I would like to know what I have. I don't like not really knowing. Personally, myself, I believe it's lupus. I was diagnosed with it, and I meet well over the criteria, in my opinion. But, you know, I don't want to, like, be in limbo and not knowing, again, what exactly is happening to me. You know, like, when I have, like, family or whatever that asks me, well, like, what is it? I want to be able to tell them without a doubt what it is. You know what I mean? So for her to say it doesn't matter to me if, like, I know what it is or not, like, it does. And so that was kind of frustrating. So I'm just, like, irritated. I just don't understand what the big deal is, why they can't make a diagnosis, like, why they are hesitant as to whether or not it's lupus. It just doesn't make any sense to me at all. So that's pretty much where I stand. That's pretty much what happened yesterday. My breathing is still not good, especially yesterday. The humidity was very high, and when the humidity gets high, it makes my breathing even worse. Just walking up the stairs to Nathaniel's bedroom and changing his diaper, I was winded. The puffer I have doesn't really seem to be doing too much. So I'm really upset that I have to wait till August. And the reason I have to wait till August for my appointment, originally I was actually supposed to see the respirologist at the end of May. But the appointment was scheduled in the afternoon when I was working. And I knew that I wouldn't be able to get that off. So I had to try and reschedule it for a morning appointment. And then it had to change to, like, the end of July. And so that was scheduled in the morning. Then I found out about the fact that I was going to be taking care of Ben come July, and that is in the morning. And I wasn't really thinking about the fact that Ben's mom has flexibility and that I probably could have worked an afternoon instead of a morning. I didn't really think about that until afterwards. So I had called them to reschedule the appointment again to an afternoon. And so the soonest they could get me in for that then was August. So now I have to wait until August. So I'm not too happy about that. I'm thinking of calling them to see if I could be put on a list. So if there's a cancellation, I could get in sooner, especially because the last week of July, I won't be working at all. And so like if something came up that week, that would be great. To me, like right now, I'd say the sooner the better because my breathing is not that great. So that's what's happening. And like, honestly, like my joints have been really good. I've noticed the grogginess after taking methotrexate has been a little bit better. It doesn't seem to be hitting me as hard. I haven't had any nausea. So this new lower dose seems to be controlling my joint pain, and I'm not really getting any side effects anymore. So that's good. So basically, if we can get this breathing issue sorted out and this jaw issue sorted out, I'd probably be feeling pretty good. Yeah, so that's my long lupus update and rant. So that's what's happening with that. So now I just don't know. Like, I don't know if I should just keep sticking it out with this lupus clinic or if I should try a new doctor. I just don't know. I really don't know. I mean, there's a lot of things I like about the clinic, but at the same time, there's a lot of things I don't like, and I am getting really frustrated with them always saying every time I go there that they're still not sure whether it's lupus or not. And it's like, how can you not be sure when I have this huge list of weird symptoms that I've had since 2002? Like, come on, get it together. You're a lupus clinic. You should know this stuff. So that's where I'm at, and I just wanted to give you that update and have that little rant, and that's it for this video. So thanks for listening to me, and yeah, we'll see you in the next video. Bye, guys. Hey guys, we are here for the 2015 Lupus Walk, and we are just about ready to start the walk. Here is Alex.
You gotta listen to the guy. Everything.
My mom.
Hello.
My dad. All right, are we starting?
Yep.
Oh, okay. Let's go.